It's post-op day 1, you made it. This is gonna be a virtual appointment. Our MA is gonna reach out to you through our video conferencing system. They're gonna talk to you, they're gonna ask you how you're doing, they're gonna make a full body assessment, they're gonna go over your pain and your medications. After the appointment, you have to make sure that you take full body photos of all the different angles and send them to us through our HIPAA compliance system so that we can make a full assessment. Most of the appointments post-op day 1 will be virtual, with the exception of those patients that are receiving their massages with us here in the clinic. For those patients, I'll be able to see you in person. It's post-op day 1 from your tummy tuck. You can expect that you're gonna be having some tightness in that belly area. You're gonna be walking hunched over. And when you go to sleep, you wanna make sure that you have a few pillows behind your back or a couple of pillows underneath the knees to relieve some of the tension in that belly area. Some patients may opt to sleep in the recliner. You're definitely gonna require some assistance initially to get up from the bed or the recliner so that you can do your walking. All of our tummy tucks will have a mandatory Vina Pro device. This is a device that goes around the legs and it keeps the circulation moving and it decreases the risk of blood clots. You must use this device for the first 2 weeks. You're gonna use it whenever you're sleeping, whenever you're not being very active. And of course, for all of our out-of-town patients, you have to use it for the flight back home. The only time you're not using this device is when you're in the shower or when you're actively walking and moving around. You're gonna have 2 drains, and our nurses are gonna teach you and your caregiver how to empty them, how to take care of them, how to measure them, and they'll do all this right after your surgery. You're gonna leave the operating room with your abdominal binder in place. The purpose of the abdominal binder is to give you a little bit of support and to hold the dressings. You do not want the binder to be too tight. It is not a waist trainer. So make sure that it's snug, but not too tight. Remember that underneath there, you have a large incision that needs to heal, that requires adequate blood supply so that it can get all the nutrition and oxygenation it needs. With the tummy tuck, your first shower is gonna be 48 hours after surgery. But remember, please do not submerge underwater for the first 6 weeks. Also, in the first 6 weeks, there's gonna be absolutely no heavy lifting and no strenuous activity because we've done that muscle repair and wanna make sure that it is intact. Post-op day 1 can be very tough. I mean, surgery is not easy. All right, but please remember, all of our staff and myself, we're here with you every step of the way.